My name is Dr. Jeremy Byers. I work for the Brookings Medical Clinic and am also one of the attending physicians at Brookings Health System. I've been here in Brookings approximately 3 years, and I see people of all ages, family practice doctor, see infants all the way up to the elderly, and I also have an obstetrical practice. Before leaving the hospital, one of the most important things for a parent to do is make sure all their questions are answered. A lot of first-time parents especially have a lot of things that they're unfamiliar with, things that are brand new to them and that are very strange with regard to newborns. So that's probably the most important thing, is to make sure you have all your questions answered and that you've read through some of the educational material that's given and really follow up on things that you're unsure about. Some things that parents should be comfortable doing are, if mom is breastfeeding, that would probably be one very important thing, knowing how to get baby to latch, how long to have baby latch for. Bottle feeding parents should be comfortable with what temperature to have the bottle, how much to give, how often to give, that type of thing. It's also important to make sure you know how to hold the baby, make sure that you know how often to bathe the child, car seat information, fever management, checking temperatures. Additionally, prior to leaving the hospital, it's important that parents are comfortable with changing their baby, both with clothing and diapers. If they had a male and it was circumcised, it's important to understand circumcision care, how often to do it and what to do. It's important to understand burping, how often to do it, when to do it, what result you're looking for. Comforting your child is another important thing to know when you're leaving the hospital. The Brookings Health System OB nurses and the pediatric nurses are a great resource for the new parents. There's a lot of handouts that they can give, hard copies to go through a lot of the newborn cares and things to expect, things that are normal that may not seem normal. And then your physician is always a good resource too, to ask questions to. For breastfeeding mothers, there is also availability of lactation specialists that will be through the hospital, and then the community also has resources that are available. Additionally, there's an option to have a postpartum doula that can help out afterward, answering questions for mom and helping with breastfeeding and some of the concerns that can come afterward. A common mistake parents make during their postpartum stay is not asking enough questions, not relying on the nurses, especially first-time moms. They maybe have some preconceived notions that they are expecting, and the nurses can be very helpful, more helpful than most people understand. After you've left the hospital, another good time to ask questions about newborn cares is at your first follow-up visit with your doctor. If you have questions prior to that, you could certainly call your doctor's office or call back up to the OB floor and ask them questions. After moms have a baby, some things they can expect transition-wise with their body is breast soreness, especially as they produce more milk if they're breastfeeding. It's very common also for the uterus to cramp more, and that causes pain, almost like one is having a period. Vaginal bleeding is also very common. If mom's had a tear in the vaginal area, that also can be painful, and that's a transition that will take some time. There's some medicines that people can use to get rid of some of the pain. Emotions can be a huge thing with mothers right afterward, and there's something called postpartum blues that typically will occur within the first 2 weeks. Probably happens with 80% of moms, and it usually doesn't last more than 2 weeks. And there's a lot of hormones, and we're not 100% sure if it's hormonal or if it's from lack of sleep or if it's just all the changes, but that's a really big thing for moms to watch out for and to be expecting. Additionally, moms can potentially expect to have hemorrhoids, which is a process of not necessarily, or not just delivery, but also being pregnant. And then Afterward, a lot of hot and cold flashes can occur, and that's another hormonal change that happens. I think parents should be comfortable getting care at Brookings Health System because safety is very good. Nurses are very knowledgeable, and I think the doctors are also very knowledgeable. We have great rates on C-sections, and we do a very good job at getting parents to breastfeed when they leave the hospital, and a good majority of them continue to breastfeed. So I think that when you combine those things, it's a great place to have children and bring children when they're sick.